If you see someone who may be choking, survey the scene and begin a primary survey by checking the airway.
Are you choking? Help!
Give abdominal thrusts if the victim cannot speak or cough forcefully, or can only cough weakly and is making high-pitched noises. To give abdominal thrusts, stand behind the victim and wrap your arms around the waist. Make a fist. Place the thumb side of your fist against the midline of the abdomen, just above the navel and well below the lower tip of the breastbone. Grasp your fist. Keep your elbows out. Press into the abdomen with quick upward thrusts. Each thrust is a separate and distinct attempt to dislodge the object. Repeat until the object is expelled or until the victim becomes unconscious.
Are you choking? Help!
To review, if a person cannot speak, breathe, or cough, the airway is obstructed. Give abdominal thrusts until the object is expelled or the victim loses consciousness.
Medium rare, one grilled shrimp, only one basil fettuccine with chicken.
Don't take my order, it's gone. Hey Michael, how's the soup today?
About an 8.5.
That's not bad, how about yourself?
Me, 9.5, maybe 10. I feel great.
You always do. How do you do it?
It's in my blood.
One of the lucky ones, I'll tell you that. Here's my order. 2 soups, 2 salads, 1 house, 1 vinaigrette, 2 angel hair pastas, 1 fish, 1 filet medium well, 2 mixed grill, and 3 Cornish hens.
Got it.
You got it?
I got it.
All of it?
Brian orders up. 2 soups, 2 salads, 1 house, 1 vinaigrette, 2 angel hair pasta, 1 fish, 1 filet medium well, 2 mixed grills, 3 Cornish hens, 2 turtle doves, 1 partridge, and 1 pear tree.
What up? What up?
With him. I'm not sure. Michael, can you hear me? Oh, I think he's having a seizure.
Did we put something in his mouth?
Oh, no, nothing in his mouth. Call 911. Tell them he's having a seizure. I've never seen Michael like this.
Is there anything we can do?
We should clear all this out of the way. He's calming down.
The ambulance is on its way.
Good. I think the seizure is over.
Is there anything more we can do?
Just wait for the ambulance.
Seizures are common occurrences but not completely understood. They may be caused by a temporary problem, or there may be no underlying causes, in which case a person is said to have epilepsy. Before the onset of a seizure, the person may experience a sound or visual hallucination or feel a sense of urgency to move to safety.
Michael? Michael! Michael, are you all right? Can you hear me? Michael! Ah! Oh, my God! Oh, Ryan, help me! Get some towels for his head!
What's wrong with him?
Call 911. Tell them he's having a seizure.
During a seizure, prevent injury by removing anything nearby that might get in the way.
Get the knives out of the way.
Do not hold or restrain the victim. Do not put anything between the teeth. Following a seizure, the muscles relax. Check the ABCs. Stay with the victim until he or she is fully conscious. Seizures can range from brief blackouts and periods of confused behavior to uncontrollable muscle movements, rigidity, and loss of consciousness. Care for the victim by preventing injuries and call EMS if necessary. There are two types of bleeding, internal and external. Internal bleeding can occur when blood vessels are broken within the body. This can often appear as a bruise. External bleeding occurs with open wounds, injuries in which the skin has been torn. To control external bleeding, follow these steps. Apply direct pressure. Elevate the wound. Apply pressure at a pressure point and apply a pressure bandage. First, apply direct pressure on the wound. Guard against disease transmission by placing a barrier, such as a latex glove, plastic wrap, or a sterile dressing between your skin and the victim's blood. If you do come in contact with the victim's blood, wash immediately after caring for the victim. Next, elevate the wound above the level of the heart, but only if you do not suspect a fracture and it does not cause pain to the victim. If the first dressing becomes soaked, do not remove it. This may cause the wound to bleed freely. Instead, cover the wound with additional dressings. If the bleeding does not stop, apply pressure to a pressure point. There are 4 pressure points used to control bleeding from the arms and legs. They are located at the brachial arteries in the arms and at the femoral arteries in the legs. Squeezing an artery against the bone slows or stops blood flow to the limb. While continuing direct pressure with one hand, locate the pressure point at the brachial artery with your other hand. Use the flat part of your fingers to squeeze the artery against the bone. Once the bleeding has been controlled, apply a pressure bandage. Begin by applying additional dressings over the wound. Use a self-adhering roller bandage to hold the dressings in place. Start by securing the bandage. Wrap the bandage snugly around the limb using overlapping turns. Cover the dressings completely. Tie the bandage over the wound. Tuck in the loose ends. Make sure the bandage is not too tight by checking the radial pulse and the appearance of the fingers. If there is no pulse,
or if the fingers are bluish, the bandage is too tight. First aid for bleeding also means caring for shock. Shock is the failure of the cardiovascular system to circulate enough blood to the vital organs. Some signs and symptoms of shock include cool, moist, pale, or bluish skin, and fast or slow heart and breathing rates. Place a shock victim in a lying down position to improve blood circulation. If you are certain the victim does not have a head, neck, or back injury, elevate the feet and legs 8 to 12 inches. It is important not to overheat the victim, but do guard against chill if necessary. If the victim vomits, place him or her on one side to avoid blocking the airway with fluids. If you suspect a head, neck, or back injury, keep the victim lying flat. If the victim has trouble breathing, place him or her in a semi-reclining position. Monitor the vital signs and reassure the victim until EMS personnel arrive. To review, first aid for external bleeding has 3 goals: control the bleeding, prevent infection, and prevent shock. To control bleeding, apply direct pressure. When possible, use a barrier between your hand and the wound. Elevate the wound above the level of the heart if you do not suspect a fracture and it does not cause pain to the victim. If direct pressure and elevation do not stop the bleeding, apply pressure to a pressure point. Once bleeding is controlled, apply a pressure bandage. Finally, care for shock. Position the victim according to the injury. Monitor the vital signs and reassure the victim until EMS personnel arrive. Three principles to follow when caring for burns are prevent shock, reduce pain, and prevent infection. The severity of a burn depends on its depth or degree, size, and location. Critical areas are the face and neck, hands, feet, and genitals. Burns are also more serious when they are spread over large areas of the body or combined with other injuries. Burns are often classified by their depth or degree, first, second, and third. First-degree burns are the least severe. The signs and symptoms are redness, mild swelling, and pain. Second-degree burns are deeper, with redness, severe pain, and blisters. Blisters may be open or closed. Third-degree burns are the most severe. The burned area may look white or charred. The victim may have either severe pain or little pain.
Look at this studio filled with glamorous merchandise, fabulous and exciting bonus prizes, including this. Experience the sporty, stylish.
Have you seen my purse, honey?
Yeah, it's right out here.
To treat a first or second-degree burn with no open blisters, flush the area with cool running water. This reduces swelling and pain and prevents further damage to the skin.
Honey, bring the first aid kit in.
Okay.
Then apply a moist dressing and bandage loosely. To care for a third-degree burn or a second-degree burn with open blisters, cover the burn with dry, sterile dressings. Bandage the burned area loosely.
This helps prevent infection and reduces the loss of body fluids from the burned area. Do not use water on a third-degree heat burn because it increases the risk of shock. Bandage the burned area completely. To review, care for burns by preventing shock, reducing pain, and preventing infection. Care for first-degree burns and second-degree burns that have closed blisters with cool water.
Apply moist, sterile dressings and bandage loosely. To care for third-degree burns or second-degree burns with open blisters, apply dry, sterile dressings and bandage loosely.